An upper respiratory infection is an infection that involves the upper part of the respiratory system. This includes the nose, throat, and bronchi. It may also be referred to as a common cold or URI, and is typically caused by a virus. Common signs and symptoms include nasal congestion, sneezing, fatigue, and body aches, to name a few. Since an upper respiratory infection is usually caused by a virus, antibiotics are not helpful. Sometimes, if there is an additional bacterial infection, antibiotics may be needed. The treatment for an upper respiratory infection is supportive. Supportive measures help your body's immune system while it is fighting the infection. Here are a few supportive measures you can do for your upper respiratory infection. Rest adequately and drink plenty of non-caffeinated fluids. If you are having a sore throat, throat lozenges may be soothing. If you are having nasal congestion or stuffiness, you may take an over-the-counter decongestant. Oral decongestants may increase your blood pressure, so do not take them if you have high blood pressure. You may take an over-the-counter cough medicine if you have a cough. You may take an over-the-counter fever reducer for fevers. It is important that you have very close follow-up with your primary provider to make sure your infection is healing and complications don't arise. Contact their office immediately for an appointment. Nothing serious was found on your evaluation today, and it has been determined that you can be discharged. Most upper respiratory infections get better within 1 week. The cough may last longer in some cases. While most upper respiratory infections resolve without any issues, sometimes complications can develop. Some complications include bacterial infections and asthmatic bronchitis. Therefore, it is important to immediately contact your primary provider or return to the emergency department if any of the following occur: severe cough, difficulty breathing, vomiting, prolonged or high fever, headache, any confusion, your condition worsens, or new symptoms develop.